I just want to have a brief discussion of, you know, everybody says multidisciplinary care, and I think the assumption is, oh, you have a medical oncologist in the room with a surgeon and a pathologist and a radiologist and but I think the multidisciplinary team is actually much, much bigger than that. And so I wanted to get your thoughts of what people aren't thinking of when we're talking about multidisciplinary care, because the number one, outside of breast cancer, the number one identifier of, genetic syndrome families is usually gets initiated by us. The patients with Leaf-Raumini, the patients with retinoblastoma, we're following these patients. And so what else is in your unique multidisciplinary teams that people aren't thinking of, which is really the importance of these centers?
Well, I would say for us, one of the most important things is our social worker team. We have a lot of young patients. Sarcomas affect people of all ages. It's not a typical carcinoma presentation of someone in their 60s and 70s. These are tumors that in adult oncology, we see people in their teens and 20s and 30s with this. They're people transitioning into adulthood who are struggling with that and with their cancer and transitioning into adulthood, struggling with that. But the dynamics between those young adults and their parents. We have patients who are young parents, who have young kids, and the issues with what's happening with their children. It's heart-wrenching, obviously, but the young adult program, adolescent young adult programs that many of our centers have, involvement of social workers who are familiar not just with cancer, but with dealing with young adults with cancer is really important.
I mean, don't forget about the reproductive endocrinologists.
Absolutely.
Because, that's complex, especially when you have a Ewing's patient that need to move fast. I mean, there are so many other members that are unsung heroes that when you really walk into these multidisciplinary centers, I think everybody's surgery and radiation, medical oncology, the depth of really what's there. Is there anything unique in London?
I think, just to echo what Andy said, basically, that there are other people, not only physicians, not only gastroenterologists, interventional radiologists, but social workers, our specialist nurses as well do such a fantastic job in terms of helping all of these people going through very, very difficult treatment and dealing with a very difficult diagnosis. So it's definitely bigger than just the physicians. It's a full team of very caring and very experienced professional staff.
In more recent years, we have actually integrated a geneticist and a physical therapist in our clinics. And as Lor will attest to it, I think from a functional standpoint, functional assessments, improving functional outcomes and stuff, I think their early involvement becomes very critical as we learn more about the genetic makeup of the diseases, and plenty of sarcomas are part of genetic syndromes and multiple cancer syndromes. So I think having a geneticist has been very helpful. And again, we haven't mentioned it, so I will put it out there. The unsung heroes of the multidisciplinary team treating these patients happen to be the nurses, the mid-level providers, and the pharmacists.
Absolutely.
Right? So I think integrating them into the team so they feel part of the team, even through the decision-making and distributing the treatment, for example, I think it becomes very great.
It's interesting, in our meeting, the superintendent of the radiology department comes to the meeting, so if we need to do a scan quickly for a new patient, she can then just get that organized after the meeting. So
that's great.
Again, just to show that it's much, much bigger than just the physicians.
And let's not forget